Hello, my name is Mark Cincagrana. I am going to be doing your physical exam today. If at any point throughout the exam you feel uncomfortable, please let me know. We will make sure that you have the adequate draping. I'm going to start by washing my hands. Then I'm going to begin with my general assessment of the patient, looking at the patient's skin, noting patient's color, hair distribution, any scars, lesions, moles, or freckles. I am then going to be looking at the patient's fingers, assessing capillary refill, as well as skin turgor and temperature. I'm going to inspect the patient's head, noting shape, symmetry, and alignment, as well as shape, symmetry, and alignment of the patient's ears, nose, eyes, and eyebrows, as well as hair distribution. I'm going to then palpate the head, noting for normocephaly, taking note of hair texture and quality. I am then going to palpate frontal and maxillary sinuses. I'm going to assess the TMJ and cranial nerve 5 by having the patient open and close their mouth. Good. And open against resistance. Good. I'm then going to have the patient distinguish between sharp and dull touch. Does this feel different?
No, it's the same.
And I'm then going to be assessing cranial nerve 7 by having the patient raise their eyebrows, squeeze their eyes shut, good, clench their teeth together, and puff out your cheeks. Good. And move your tongue side to side. Good. I'm then going to assess the eyes, looking at the shape and alignment of the patient's eyes, eyelids, eyebrows, the palpebral folds, the sclera, conjunctiva, and the iris. If you can look up for me, please. Good. And look down. Good. I'm then going to assess the patient's vision by having them close one eye and reading the Snellen chart at the lowest line they can, assessing cranial nerve 2.
ECTPNL.
Good. And the other eye, please.
ECTPNL.
Good. I'm then going to assess visual fields. If you could raise your hands when you see my fingers. Good. And cranial nerve 3, testing for accommodation. Look right at my finger and follow it into your nose. Good. I'm also going to be assessing extraocular movements. If you could follow my finger. Cranial nerve 6 in the left, 3 in the right. Cranial nerve 3. Cranial nerve 3 in the left, 4 in the right. Cranial nerve 6 in the left, 3 in the right. Cranial nerve 3. Cranial nerve 3 in the right and 4 in the left. Good. And then I'm going to dim the lights and I'm going to assess patient's pupillary response to direct and consensual light. You can look straight ahead, please. Good. And then going to be assessing the patient's eye, looking at the back of the eye. If you can look straight ahead, just come in, and looking at for the red light, the optic disc, the macula, veins, and arteries. And I'm going to be doing the same on the left. You can look straight ahead, looking at the red light, optic disc, the macula, and any veins and arteries. I would also have the patient look straight ahead into the light at one point during the exam. Next, I'm going to be examining the patient's ears, looking at shape and symmetry. I'm going to be palpating the auricles and the tragus, as well as the mastoid for any tenderness. I'm going to be inspecting the external ears. While inspecting the external ears, I'm going to be looking at the canals for any foreign bodies, any swelling, edema, fluids, taking note of color, as well as looking at the tympanic membrane for color, shape, fluid, any scarring or perforations, noting that the cone of light is at the 5 o'clock position on the right. I'm going to be assessing the same in the left, and noting that the cone of light is at the 7 o'clock position in the left. Next, I'm going to be assessing cranial nerve 8 by performing the whisper test. I'm going to cover one ear, and if you could repeat what I say. If you could just say it loud for me so I know you're hearing. Okay.
1, 2, 3.
Good. And then perform the Ryan and Weber test. Can you tell me where you're hearing the vibrations on both sides? Good. Hearing it on both sides is normal. And tell me when you can no longer hear the sound. Can you still hear it?
Yep.
Good. And then the same on this side. When you can no longer hear it. Can you still hear it?
Yep.
Good. And bone conduction, or air conduction, should be 2 times bone conduction. Next, I'm going to assess the patient's nose, looking at shape and symmetry. I am going to ask the patient to tilt their head back, and I'm going to be looking at the mucosa turbinates in the septum. Good. I'm going to assess patency of the nose. You can breathe in. Good. And breathe in. Good. I'm going to assess cranial nerve 1 by having the patient smell 2 different items. You can tell me what you smell.
Vanilla.
Good.
Peach.
Good. Next, I am going to be inspecting the patient's mouth, taking note of the lips, looking at symmetry, color, and if you can open your mouth for me, please. And I'm going to be taking note of the patient's oral mucosa, the anterior and posterior pillars, the uvula and the tonsils, the hard and soft palate, as well as the base underneath the tongue, gums, and teeth. I'm going to be assessed cranial nerve 9 and 10 by asking the patient to say ah and swallow. Good. I'm then going to inspect the patient's throat. I'm looking for any tracheal deviation or asymmetry. And then going to palpate the trachea, identifying the cricoid cartilage. And if you could swallow for me, please. Good. And I'm going to assess the thyroid by displacing to the right and swallow again. Good. And displacing to the left and swallow again. Good. I'm going to be noting for any nodules or palpable masses. Next, I am going to assess cranial nerve 11 by having the patient shrug their shoulders. Good. And I'm going to assess lymphatics, how do the preauricular, the postauricular, the occipital, submandibular, the maxillary, posterior cervical, the anterior cervical, and the deep cervical chain, as well as the supraclavicular and the epitrochlear. At this point of the exam, I'm going to ask you if you could take off your gown. have a seat back down for me, please. And I'm going to be inspecting the patient's chest and thorax, noting for symmetry and muscle development of the shoulders and alignment. I am also going to be noting patient's respirations, looking at rate, rhythm, depth, and effort, and pattern, noting for any signs of shortness of breath, including audible wheezing or retractions. I am then going to start by palpating the patient's anterior chest, looking for any tenderness, deformities, or crepitus. And then going to assess the patient's scapulas and cervical spine, and the rest is thoracic and lumbar. Good. I'm going to assess for any CVA tenderness by palpation. No tenderness, which is normal. I am also going to be assessing patient's diaphragmatic excursion. You can take a deep breath and hold it. Good. And once you relax, take another deep breath, exhale and hold it. Good. Diaphragmatic excursion should be between 3 and 5.5 centimeters. Next, I'm going to be assessing for a tactile fremitus by having the patient say 99.
99, 99, 99.
Good. And if you could spin for me, please. And again, I'm going to have the patient say 99.
99, 99, 99.
And then I'm going to begin with percussing into your chest. Good. And I'm going to percuss the posterior chest. Good. I'm going to listen for one respiration at each position. And I'm going to assess for egophony by having the patient say E.
E, 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 E.
Good. And bronchophony by having the patient say 99.
99, 99, 99, 99, 99, 99, 99, 99.
And respiratory pelicoid, if you could just whisper 1, 2, 3. Good. And then I'm going to spin. And then I'm going to also take the front chest for one breath cycle. Good. Next, I'm going to begin the assessment of the cardiac. I'm going to be looking at the precordium for any thrills, heaves, or lifts. I'm also going to be palpating the precordium for any heaves, lifts, or thrills. Good. For the next part of the exam, if you could please have a seat in the exam chair. going to be reclining the chair to a 30-degree angle and have the patient look to the side. I'm going to be using my light to assess for JVD from the sternal angle and noting its height, which should be less than 3 centimeters, which it is. Next, I'm going to palpate the patient's carotids. Going to listen to the carotids for any bruise with the bell. You can take a deep breath and hold it. Good. Take a breath and then hold it. I'm going to be assessing for heart sounds. The aortic, the pulmonic, the tricuspid, and the mitral. Good. I'm going to have the patient sit up and lean forward, assessing for aortic regurgitation. Good. And you can sit back down. And I'm then going to be listening over the lung for the heart sounds again with the bell of the scope, listening for any murmurs and bruise. And while at the mitral, I'm going to put the patient in the left lateral position, assessing for any mitral stenosis. And while in this position, I'm going to palpate for the PMI. If you can take a deep breath and exhale. Good. I'm going to continue on assessing the patient's pulses, starting with the brachial, the radial, patient's femoral. You know, cross your legs. Thank you. Popliteal. Patient's DPs and posterior tibial. Same on this leg. Posterior tibial and DP. And also going to be assessing the calves bilaterally for any swelling or tenderness, which there is none.